Hello, and welcome to today's discussion on raising more awareness of harm reduction tools to manage substance use disorder, presented by the Trenton Health Team. I'm Mina Lona. I'm a media professional with over 10 years of broadcast experience in television, radio, and digital media. I am honored to be moderating today's event. Today, we'll speak with 4 professionals who specialize in harm reduction, social work, mental health, and substance use treatment and education. Our goal is to raise awareness, so we're going to explore this important topic and highlight the resources and support services available in Mercer County. If you or a loved one reside in Mercer County and are struggling with substance use disorder, this program is for you. We are excited to be joined by some of the top experts in this field. First, we have Jenna Malore, who is the Executive Director at New Jersey Harm Reduction Coalition. Jenna is a harm reduction specialist with over 10 years of experience at the intersection of direct service and public policy. Next to Jenna is Lee Rushcheck. He is the Senior Director, Behavioral Health at Henry J. Austin Health Center. Lee has extensive experience with a variety of populations ranging in ages from 5 to 75 years old. He has worked directly with both mental health and substance use clients in nonprofit settings as well as the private practice. Seated beside me, we have Michelle Christopher Simmons. Michelle is the Associate Behavioral Health Services Area Director at Catholic Charities with vast experience in clinical social work. Our final panelist is Barrett Young, the CEO at Rescue Mission of Trenton. In addition to his role at Rescue Mission of Trenton, Barrett is the co-founder of Penn Restorative Entrepreneurship Program, a one-of-a-kind partnership between the mission and the university. They offer an extensive training program led by Penn faculty and students to a small group of formerly incarcerated individuals with the goal of helping them start and succeed in running their own businesses. Welcome, everyone. That was a mouthful. How are you guys?
Good.
Wow. Happy to be here.
Right, same here. So I wanted to start our discussion about all the topics that we have in mind today, especially harm reduction, substance use, not abuse, which we've talked about behind the scenes a little bit. But Jenna, for those who are not familiar with the term, can you define a little bit and describe what harm reduction is? Because I'm obviously learning a lot from you guys during this panel discussion.
Well, I love that you're learning because a lot of what we have to do together is unlearn a lot of the stigma that we've been taught about drug use and learn about how to support one another non-judgmentally. So I really appreciate the approach that you're bringing to all of this. Harm reduction is something we use every day in our lives. We do things all the time that have risk involved. We cross streets, we drive cars, we have sex, we go on...
Thanks.
Yeah, or, some people sometimes have sex, for sure. We go on dates with people we haven't met before.
Right.
There's risk in everything in life, and we take steps to reduce those risks. We wear seatbelts.
Right.
We text a friend to let them know where we're going. We use a condom or pregnancy, birth control. We take all kinds of risk reduction steps in our life. When it comes to drug use and substance use disorder, harm reduction is no different. It says that there are risks with using drugs. There are. There's risks of overdose. There's risks of developing an addiction or substance use disorder. There's risks of acquiring HIV or hepatitis C or losing your control over your life in a way that you want to have. And so what harm reduction does is it says there's inherent risk, there's also benefits. What is this drug giving you?
Right.
Is it celebration? Is it connection? Does it bring you some kind of comfort in a very difficult time? How can we reduce your risk? How can we support you in your autonomy and your own choices? And how can we make sure that you stay alive and that you get to have a life full of satisfaction? We make it about the person, not the drug.
Right.
And I do want you to know that it works. When people have access to harm reduction services, they are more likely to find drug treatment than works for them and less likely to acquire an infection like HIV or hepatitis C, and also more likely to survive the overdose crisis.
So Lee, you have a very specialized way of dealing with all of this, right? Substance use disorders, you have tools, methods. Can you talk about that a little bit?
Sure. I think the key right now is there's been a big shift in the field from harm reduction was not something that we spoke about, that it wasn't an approach we took, it wasn't a philosophy. And I think the field has done a huge turnaround to really focus on the person which is where we need to start treatment. There are all kinds of treatments available for people. There are medication-assisted treatments for Suboxone for people who have an opiate use disorder. There are injections for people who have an alcohol dependency. So there are different levels. You can come in and just talk to somebody briefly, up to you can go to a program 5 days a week. You can go inpatient to detox. You can go to, so there's such a variety of services that are available. It really is about having a conversation with the person, seeing where they're at that moment, what they're willing to do, and how to connect them to the service that they're willing to use at that point in time. Now that may change, and maybe it's variable, and you keep working with the person as their wishes and their needs change to match them to the service that they're willing to do at that time to maximize their level of success.
I think one of the things, Lee, that, and Jenna, you both kind of talked about is, it used to be the mentality in the substance treatment world was, this is how you're going to do it. You're going to go to a 28-day program. You're going to do this. You're going to learn how to grow a flower. You're not going to date anybody. You're going to do we've all seen the movie, and that's not reality, and that's not real. And really, what I have seen in my 18 years of working in this field is the more that you try to tell someone what they have to do and how to do it, they're even more resistant to anything that you're trying to put on the table, because they're immediately saying, you're trying to tell me what to do and how to do it, and none of us want to be told that, right? You're saying,
not about losing weight.
No,
not about who you date.
Right, none of it. And it's a huge step in the world of saying, okay, we're gonna meet you where you're at. Why don't you meet me here today for a cup of coffee, and I'll give you some Narcan. Oh, okay. And then maybe that just blossoms into, you never know what's going to happen in the world now with the treatment, because there's also so many more modalities of treatment and opportunities for treatment, and some of it is the person who you're helping doesn't even realize that they're getting treatment at that point. They're just like, oh, okay. We were talking earlier about the Mission's mobile unit van. It's been on the street for about 4.5 months now. And one of the best things that I've learned through this is how I knew addicts were resourceful, and they're very smart.
No, people with substance use disorders.
Yeah.
Thank you.
Or people who use drugs, and that's another thing that we're doing, is trying to move to person-first language.
Right.
But a lot of times people also self-identify as an addict, and that self-identification can be really important too. But you were saying...
So sorry, what I was gonna say was, we were talking about this before we got out here, was one of the biggest things that's driven people to come to our van for help is we distribute Narcan. And they get it and they put it all over in the different areas where they use in the city. They put the Narcan, and they all know where it's at. And they know where to come and get it. If they use it and they run out, they know where to come and get it from our mobile van. And I think that's a step to them saying, okay, these folks are here to help me, and if and when I'm ready for help, they're going to be here to help me. And we're not to judge what that help is.
And to piggyback on that kind of is, what both Lee and Barrett were saying, is that the substance use community has grown exponentially. It used to be the abstinence-only model. You have to stop using, you have to do it today, and you have to do it in the way that we say. And thankfully, we've grown by leaps and bounds. We've become a lot more open-minded. We understand that one approach does not work for everybody, and what works for one person will not work for another person. It allows us to take into other considerations as to what might be contributing to why they can't, just stop using. Are there medical complications? Are they pregnant? Is there cultural factors that play into their substance use?
Or maybe psychologically, maybe
Absolutely.
something mental health.
Absolutely.
Right.
So it takes all of those factors, it takes them into consideration, and it allows us to create treatment plans that are individualized to every single person.
One of the other things that's really started to transform in the industry is mental health and substance use disorder kind of being put together, right? Forever, they were treated, you have a mental health disease. You go over here to those hospitals, and you have a substance use disorder, you go here. And it is darn near impossible to find a substance user who does not have a mental health issue. And it might be as small as trauma. You've been on the street. That's traumatic. You've gone to prison. You've gone to jail. That's traumatic. You've lost a job. That's traumatic. Whatever it is, those are traumas. And no one ever, it was like, oh, wait, they have a mental health. We can't treat them here. No, you treat the whole person, as Lee talked about. It's the holistic approach. You're looking at the whole person. Because if you're just addressing one piece, what happens to all the other pieces? So they stopped using drugs and or alcohol or whatever. They're clean for 28 days. Now they go home, but all these other things are still very alive. Right. So what are they going to do? Of course they're going to go back to using or drinking. They don't know how. They didn't learn the tools.
And if you approach somebody with substance use and say, just stop using. You need to be clean. You have to be clean. That seems insurmountable. That seems impossible to a lot of people. And it seems a little bit easier, like Barrett was saying, let's just go and get a cup of coffee and talk. Right. Let's see what is the first step that we can take? We're not talking about climbing that giant mountain. We're talking about taking the first step. And that just is a lot easier for people. And then they realize that they can make progress without being so overwhelmed with the idea of, I just have to stop using.
Right. History is important. There's a reason that we've taken an abstinence-based approach. It's because during the Prohibition era, doctors who took a harm reduction approach were shut down by the federal government. It's because we had a war on drugs declared on people who use drugs, and Just Say No, and that's where all the money went. That's where all the attention went. And we've had that for decades. And people who use drugs have been fighting for a harm reduction approach for decades too, and saying this is what works, this is what saves lives. What Barrett shared, what the van is doing, that is people who use drugs having tools in their own hands.
Resources, yeah.
Yes, knowing this is how I use them, this is how I save a life. And that autonomy and being the agent of your own change, that is what makes the difference here.
So let me back it up minute too. I agree wholeheartedly, but let's back it up even a little bit different. Is that all of us are looking at the human being, okay? We are engaging the human being, not the addict, this is a human being in front of us, and our primary goal is to engage them where they are at, regardless of where they're at. And as we approach that, then that allows us to create a safe place. That's what Barrett's van does. They go out and they meet the person where they're at, in the street, under the bridge, whatever, and let's just have a conversation and let me engage you human to human, and then let's have a conversation and see what we can do next.
So Jenna, you mentioned tools. Michelle, I want to talk about some of the tools. Like, what are some of the tools that you offer with harm reduction and just helping people get through this point in their life?
Sure. So, at Catholic Charities, we offer, medication-assisted treatment. We offer a variety of levels of care, of clinical care. So, you can come in for individual sessions, you can come in for groups, you can come in for groups more frequently. We offer a ton of wraparound services. We do have mental health components because, as Barrett mentioned, that's huge. So they can get their mental health treatment, they can get their substance abuse treatment, they can get things like supportive employment, really just services to kind of wrap around them. We're also in a collaboration that we have called For My Baby and Me, with the Rescue Mission and Capitol Health and Homefront, that offers services to pregnant women and new mothers who have an opiate use disorder. And so historically, that population wasn't able to be treated. Most places would not treat them. They said, oh, you're pregnant and you're using substances, there's nothing I can do, good luck. And now the approach is so great, it's such a wonderful collaboration where we can offer them medication-assisted treatment so that they're not, going into withdrawal and putting risk to their baby. Where they can, leave the hospital with their baby in their custody. They can go to Homefront and have a safe place to live. They can get all of the services wrapped around so that they understand what the joy is of being a new mom and losing some of that stigma and also that fear of, is my baby safe? Am I doing the right things? Do I have support? So the harm reduction tools that we offer are very extensive.
So you mentioned the van, Barrett. Can you talk about some of the tools that your organization has and some of the things that you offer?
Yeah, I think just to kind of piggyback on a little bit of the conversation we're saying in regards to tools, I think what is wonderful about our community, Mercer, and I'd say Mercer County's community is and it's spearheaded by the county itself. The county, Mary Grace and Ann and Heather and DeWay with the county are just, they're such wonderful people to work with. In this community, they help to drive this community to stay focused on really what Lee was saying is we're trying to treat the person as a human being, and we're not in it just saying, hey, this is my client and that's how I'm gonna make this work. And that, I think, is such a great approach. And so when you talk about like a tool, I think that's the best tool that the community has, is I'm not that worried about me getting all the credit for it or who gets the credit, is did we help this person and did we help to save their life? You know, one of Lee's great sayings that he says a lot is, we have to keep the person alive for today. That's what we're doing. We're keeping them alive today, and we'll address tomorrow when we get to tomorrow. And you know, so those things I think are just wonderful. Those are the best tool that we have in our community, I think, is the partnerships that we have. But to focus on the van for a minute, is the van is a new approach that the county received funding, and they put out an RFP, and we were fortunate to get awarded that grant. And I think the reason why we got the grant was we partnered with Henry J. Austin. I called Lee and Dr. Evans, and I don't think, it was a 2-second conversation. Sure, what do you need us to do? So I called Henry J. and I said, look, you guys do MAT, you do mental health, and you also have the primary care. Great piece. I called Iron Wellness, who does outpatient, methadone, Suboxone, and mental health. Called Catholic Charities. Catholic Charities, you know, and the Rescue Mission do a lot of the same work. We could, and their executive director Susan says to me, Barrett, if you guys are gonna go in for it, we'll just partner with you. There's no reason. And so we sent in a grant with 4 really, really solid agencies together. Yeah. The mission was the lead on it, but we didn't get into all we got out of it was we got the money to buy the van and to put the staff on the van. And all these other partners came together, and we're now able to get people wherever they need to go, right? We have the ability, if they come up to the van and they say, we were talking about the wound care, right? We can get them on a call right there, telehealth with Henry J. We've gotten over 9 people into treatment off of the van. Walking up to the van, here's a cup of coffee, here's a sandwich, here's some Narcan, see you tomorrow. Okay, and through that process, we've gotten people to go to detox, to go into inpatient. We just had a guy come back who we've known at the mission for years. I just saw him a couple days ago, and he comes in, he's in the parking lot. Hey, Mr. Barrett, how you doing? I said, what are you doing? And he says, I just got out of detox. I'm going to residential. I'm going into your residential tomorrow. That's what it's about. And he was delighted. 6 months ago, he wanted nothing to do with any of that, but he, took advantage of the services that are there. And I say that all the time, and people look at what do you mean take advantage? Yeah, take advantage of what is being offered, right? The system and the world has taken advantage of substance users for so long. There are so many opportunities out there now. So many, if you want to call them tools, call them tools. But there are opportunities to succeed. Use them, take advantage of them.
I want to talk a little bit more about supplies, because there are so many opportunities and we need so many more opportunities. And one of the supplies that we haven't heard mentioned is safer use supplies. So that is access to new syringes for injection. That's access to safer snorting kits. If you're snorting comes with less risk than injection. So sometimes on people's path to whatever they are looking for in terms of safety and risk reduction for themselves, it might mean I'm snorting instead of injecting. And then there's safer smoking kits. People who are smoking cocaine can burn your lips. It can come with a whole host of possibilities of infection there. And these supplies, they were criminalized in New Jersey for a very long time. And they just became expanded access to them. Everyone here was part of making that happen. And there's something we're gonna start seeing a lot more in these types of programs, because it's such a practical way to say to someone, you're welcome here regardless of your substance use, wherever you're at on it. Here's safety tools, and it respects that people are doing stuff every day to take care of themselves. Those little pieces add up. It builds a lot of intrinsic desire for more.
Do you guys have data that proves that this stuff is actually making a huge impact?
More data than you could possibly imagine. Yeah. It's the most, I honestly can't imagine something that's more evidence-informed. People who use drugs who were demanding syringe access in the 80s were really smart and said, we're going to partner with academic researchers right away. And the CDC has this out there. You're half as likely to acquire HIV, half as likely to acquire hepatitis C, 5 times more likely to find drug treatment, choose some drug treatment option, and 3 times more likely to stop using a drug that causes you issues in your lives if you have access to a harm reduction program.
In addition, there's been a lot of studies that have come out that the old way of thinking, that abstinence-based, doesn't work.
Yeah.
It's just a revolving door of people going in and out and in and out and in and out, rather than saying, okay, where are you at? Let's start there.
I think the another thing that when you talk about that, Jenna, is when you talk about harm reduction or just being the access point for harm reduction or just Narcan, or even on the van, a sandwich or a bottle of water or a sweatsuit, right? All those things, right, are little things. They're little pieces. But what is it telling the person? To Lee's point, we're treating you. You're valued as a person. 1. 2 is this is a safe. You said it, this is a safe place, and we're not going to judge you. That's real. It is. They don't judge for nothing. For nothing. And what happens is the person then starts to feel more comfortable. They feel more safe. They may share a little more. You know what? Maybe I will take a little Narcan. The last time I shot up yesterday, I was a little, and it's just those little nuggets that you're planning, and you never know when they're going to say, you know what, today.
Help me now.
Yeah, help me now. But you got to strike. You got to strike while the iron's hot, because it could be help me now, and 5 minutes later, I'm good. But when you talked about the mobile unit and the tools. Right there and then. You want to go? We can get you over to Catholic. We'll get you. We make a phone call. Somebody comes and picks the person up right there, and takes them to Iron, takes them to Catholic Charities, takes them to. It is amazing to watch and see it happen. And I know earlier today they talked to Bev, who's our lead on the van. She's just phenomenal, right? And I think. One of my favorite moments this year with the van was we have our monthly MAT call, and they were out on the van. They go out 6 a.m. to 10 a.m. and the meeting is at 7:30, and they're on their phone on the meeting, and they're engaging with the clients right then and there. And it was cool to see it in real time.
And how do we remove barriers to treatment? What barriers are we seeing, and how do we remove them? Not just at Catholic Charities, but at the Rescue Mission, at Henry J. Austin, at any of them. How do we remove these barriers? Is it something that we can do internally? Do we need the extra support? It could be something as simple as transportation. I don't know how to get where I need to go. So, Catholic Charities has the medication-assisted treatment coordinator for Mercer County, and he's more than happy to pick them up wherever they may be and drive them to whatever treatment facility they need to go to, whether it's one represented here, whether it's one that's inpatient. He's more than happy. Things like meeting their needs, food insecurities, clothing, transportation, childcare. We offer childcare while people are in treatment. So it's really just how do we work together as a team in Mercer County to remove barriers to treatment.
Do you have any advice for using those tools?
Sure, just use them. Reach out.
Walk into any of our programs.
Absolutely.
And say, I want to talk to somebody. I want help with substance use disorder, and somebody will be right there to help them.
Walk into any of our locations and just say, I want help, and you will be wrapped around with exactly what services it is that you need. And everybody is easily accessible. We all have phone numbers. We all just have walk-in hours. Just ask for help. Just ask for help, and you will be given help. That's simple.
And Trenton and Mercer County deserve a lot of credit because I mentioned those really restrictive laws. New Jersey was the last state in the nation to have a legal pathway to syringe access, which is a form of harm reduction. Trenton was one of 2 cities that said when the law changed, we're going to do this. And Hyacinth Foundation operates the syringe access in the city. And these Mercer County, this conversation today is coming because Mercer County, everyone here, these folks, looked and said, who did we lose this year? And what was their experience? Where weren't they reached? Where weren't their connections? And then they came together and they said, the missing link is a harm reduction approach. We're going to do that. We're going to expand that.
Now I want to shift gears a little bit to discuss substance use recovery and how that work is being done and how it's being reframed and how we think about it and you know, what's being done with that.
Most people who use drugs aren't living with a substance use disorder. And then for people who are, most people aren't interested in treatment or abstinence at any given time. And then for the people who are interested in that, we know that returning to using a substance that's causing you problems is an expected symptom of a substance use disorder. And that's really the reframing.
How do you know you just are using substances versus now I have a disorder? Like, what is that line?
Well, you can talk to someone like yourself, but we know, right? We know when something in our life is causing chaos. We know when we're spending money that we want to put somewhere else. We know that I really love my kids. I want to be there, but I'm not. People know when something's off, but the thing about reframing is that let's think about other chronic health conditions, diabetes, anxiety. When I have a panic attack, I don't get kicked out of my housing. I don't have my job say, well, you can't work here anymore. I don't have child protective services saying, I don't think you're fit to have your child, to raise your child. I hopefully have people who are saying, what do you need right now? And supporting me in my chronic health condition. With substance use disorder, for years, we've been doing the opposite. We've been saying, hey, the symptom of your chronic condition, continuing to use a drug that's causing you issues, yeah, we're gonna take a lot of stuff from you. We're gonna make it really hard for you to get care. You're gonna show up to the hospital, you're gonna be treated like you're less than. We're gonna treat you like you have a moral issue rather than a health issue that you need support for.
And I think to answer your question, how do you know, right? So you don't have to have a substance use disorder to recognize that it's negatively impacting your life. I think some people sometimes are using a substance and find that it's negatively impacting something in their life, but maybe don't even meet the criteria for a disorder. But it's really individualized. I mean, we have diagnostic tools that give specific criteria that we go down and all of that. But what it comes down to is your use of a substance impacting your life? Is it impacting you at work? Is it impacting you with your family? Is it impacting your functionality? Are your finances impacted by it? Really look at the impact that it's having on your life as a whole. And then the physiological component of that, are you experiencing physiological symptoms when you don't utilize that substance anymore? Are you having any withdrawal symptoms when you are not using, say, alcohol or opiates or something like that? And if so, then that's something that you need to take into consideration too. So all of those are warning signs, but what it comes down to is if you are concerned with your own substance use, then seek help. You don't have to meet a criteria or a definition. Walk in.
Barrett, I want to talk about some key things to keep in mind when you're discussing recovery for people who are directly and even indirectly affected.
Yeah, there's a million things that you can say are keys, right? I think Jen has touched on it a bunch of times. Is where are you sleeping, right? Where is a person sleeping? The mission, we have a shelter, we have residential, and we also have permanent supportive housing. So we get to see the incremental changes that you see in a person just by having good housing, right? Is key, but that's not the be-all, end-all, right? It's like when we were talking about earlier, like just stop using. Just get a house and you'll be fine. No, that's really not, that's not the case. You also have to be able to support yourself, right? And that comes with workforce development, with training, with having a career, working a job that is, you're the fry cook at McDonald's. People look at that and say, okay, I'm getting some money, but that's not really, I can't live off of that. And it goes back to the whole thing of trauma. They look at it and they say, well, there it goes again, I'm gonna get evicted, I can't do this, I can't do, there are so many levels to what you have to surround that person with to live in recovery. And Lee said it, I think, earlier it's everybody has a little bit of a different approach, right? But every one of us, it doesn't matter, addict, in recovery, never doesn't matter. You have to have sustainable housing. You have to have sustainable employment.
You need medical care.
And I was going to say, and you have to have good medical care.
Right.
Right? And if you have those pieces around you, you feel a little more at ease, right?
Secure. With security.
Do I always use my medical care the way that I should? My wife would say, heck no, he never calls the doctor. But I have the option to do that. Right. A lot of the consumers and the folks that we serve, they have access to it. They don't know how to even start to use it, right? You know, they could, and they're like, well, Henry J., what's that?
We do need to talk about accountability. We have had I think there's a lot of people who rightfully say, now that we see white people dying, we see the state doing more support and less punishment. Yeah.
Where do you think drug court came?
And that, the war on drugs is deeply racist, targets Black and brown residents, and it is deadly. And we are shifting now to a harm reduction approach, and you look at what people have access to, and we see that Black residents do not have as much access to medications for opioid use disorder, that not as much access to naloxone. Overdose rates are rising fastest for Black and Latino Latinx residents. And so part of this work that we're here for is how do we embed what we're doing by and for communities, by and for people who use drugs, by and for people who are using any services.
In January, we're with a partnership with the county, we're able to add a second shift on, right? Which is going to be fascinating and fun to me to learn about it, is we're now gonna put our mobile unit, we're gonna try to have Henry J's van there, and Iron Wellness is gonna put their van there. So you literally, it's gonna be like it's gonna be the food truck, but for treatment, right? The food truck bazaar, but for treatment. You need mental, go right over here. You need that to go. I think it's going to be a game changer, even more than the mobile unit already has been a game changer, because it's just more and more access, right? You just get access to it. It doesn't matter where you get it, right?
Yeah, and to anyone listening, you're not alone. A part of harm reduction is it's people who have been through it, and also that we matter. We all matter. Yeah. You matter. We all matter. And, New Jersey Harm Reduction Coalition, we will mail you free naloxone. You can text or call 1-877, the number 4, Narcan. But I think all of us, we've all tried to get help for something hard, right? And it's been really scary. I think probably everyone listening has tried to do something really scary that they've been afraid of. And we're just here to be we want you, and whatever you're going through, whatever you're feeling, we're just gonna be there side by side. That bottom line, that is what it is.
I would like to add, we would never turn a person away who is having a heart attack. Mm-hmm. You would never turn a person away who is having a stroke, okay? Right. Because they can die. Mm-hmm. When you turn a person away who has substance abuse, the chances of them dying are huge. So why are we turning them away?
No insurance is required. No
Exactly.
payment is required. I know that's a huge barrier to treatment. I know that's why a lot of people are afraid. If I just show up somewhere, how much will this cost me? What if I have to apply for Medicaid? Yeah. Are they going to check my immigration status? Nope. And none of that happens. None of us will do that. Right. We will help you. We will help you regardless of the language that you speak, yep. regardless of your immigration status, regardless of your ability to pay, or whether you have insurance, able to get insurance. None of that matters. If you need help, regardless of your situation, if you need help, show up to one of us.
And I think it goes to what you were saying, Jen, is that whole mindset and stigma, right? It's got to change, and Lee, I've heard you talk about this before, and you're very passionate about it. You can hear it in your voices. You don't turn people away when they're sick. No. But for years and years and years, not just this community, but the country has turned their back on addicts because they're an addict. No, they have a disorder. Now let's help them.
They're a human being who deserves respect and deserves treatment regardless of anything else that's going on. And I believe that all of us here strongly are here to serve the person who needs the help.
Well, thank you all today for talking to us and educating us. I myself learned so much. I mean, even just not using the term substance abuse versus substance use disorder was a big thing for me. And, just the various tools that are available and the methods to recovery and just even reframing recovery and just thinking about it differently. Thank you a lot. I really appreciate this conversation. Thank you. And I want to thank you all. I feel like we need to clap, no? And I want to thank you all for joining us at this event. A special thank you to our panelists who shared their knowledge and expertise. We hope you learned something new that can aid you in your own journey and in your own efforts with your friends, your loved ones dealing with substance use disorder. Remember, there are resources available to you. Simply call, text, view the information on your screen,